Yes, top of the moment to you anywhere where you watch us. Like we did say some few minutes ago, say another Ogbonge program will come your way, where we call Health Matta. Health Matta na program where we design, where we web. On top say waiting, on top say well-being, na pataki, na koko, na very important thing. Meaning be say we have to look after ourselves, you have to check yourself, you have to know wetin dey shele as far as health dey concerned, because health sef na im be wealth, and wetin dey disturb the whole world, the plague, the pandemic wey dey disturb the whole world, na im we don dey dwell on top for weeks if not months ago. With we are very sure Dr. Bartholomew Ofegbolam, the CEO, Grace Valley Medical Center. He don dey here with me, and we go dey do justice to the matter together. Good morning, doctor.
Yeah, good morning, Chief.
Let's start with your face mask. This is different. This is out of this world.
Yeah.
It has something, I don't know. So why this, and can I use this?
Yes, you can. We'll talk more about it as the program goes on today.
Okay, it's not medical. This is 3M. It's not medical.
It's medical, though.
But I can't use it. I'm not a doctor.
It doesn't matter.
Wow.
So long as you can lay hands on anyone, anyone can serve at this moment.
Okay, sir. But this is lovely.
Yeah, thank you very much for pointing it out. Good morning, viewers at home and around the world. We are happy to be back today on Health Matter. We'll be looking at COVID-19, coronavirus pandemic. It was a topic we started about 9 months ago, or about that. Okay?
9 months?
Yes. We're in the month of September. Roughly
about
about 9 months. Yeah, 9 months ago. Coincidentally, too, the number of people that have suffered or that have died as a result of this scourge, as of today, stands at 993,462.
Why the 999? And the 9th month too.
Yeah, more like 100,000 people dying per month.
And the 9th month, Dr. Bats, don't scare also.
On the average. Okay, so let's look at the overview of where we are at the moment. Okay, we also would like to look at the updates that we have with respect to vaccine, okay, as well as all other matters that have to do with coronavirus pandemic. Let me start by saying that a lot of people are beginning to ask some certain questions. What is going on? People are no longer using the face masks. People are no longer observing the infection prevention protocols, IPC protocols. They're no longer washing their hands as we used to see sometime at the middle of this pandemic. What has changed? Also, the figures that we are beginning to get in the last couple of weeks, let me say 5 to 6 weeks ago, are also declining progressively, okay? But occasionally we'll see some certain jump. What has happened? What has changed? Is it that we've been able to contain the virus? Is it that we've been able to contain the pandemic? Okay? These are many more that we'll be looking at this morning on the show, okay? Now let me start by giving us an overview of where we are with respect to the affectation on the global scene. At the moment, 32,762,790 persons have been infected with coronavirus scourge or contagion. Out of this figure, almost 1,993,462 individuals, sort of 6,538 shy of 1 million people have actually lost their lives to this contagion. Sadly, unfortunately too. Out of the 32.7 million people affected, 24,174,866 persons have equally recovered from COVID-19. I also would like to look at the active cases we have in the world as of today. The number of active cases we have now stands at 7,594,462 persons. Out of this figure, 7,530,586 persons are said to have mild COVID, There are mild COVID condition. And 63,876 persons, which of course stands at about 1% of the number of people affected, are currently said to be in serious or critical condition. Now you will agree with me that as it stands, the COVID-19 pandemic is not abating, as some of us erroneously thought. Let's look at the affectation with respect to countries of the world. At the moment, US has gone past 7 million mark. And in the last 24 hours, 53,629 persons were the new cases recorded in the US. And of course, US has surpassed another green milestone of having more than 200,000 people dying to this contagion. Specifically and precisely, 208,440 persons have so far died in the US. My source is Worldometer. And of course, after US comes India with over 5 million people, 5.9 million people, almost getting to 6 million have been affected. And India at the moment appears to be the new epicenter. The number of people that have been affected in India, the new cases in the last 24 hours stood at 85,468. Yesterday, they equally have, or 2 days ago, they equally had about that figure, over 85,000 persons, new cases. And so far, total deaths in India stands at 93,410. Third on the list is Brazil with over 4 million cases. Russia has over 1 million cases. And of course, when we bring it nearer home, South Africa tops the African chart. Thank you very much. With 667,049 persons. That's the total number of, that's the caseload in South Africa, the number of people that have been affected in South Africa at the moment. Morocco comes second with 110,099 persons. And of course, we have Egypt with 102,513 persons. Ethiopia has gone above Nigeria with 71,687 cases. And Nigeria at the moment occupies the number 5th position with 57,849 cases. And of course, over the last 24 hours, Nigeria saw 213 new cases. South Africa saw 1,480 new cases. Morocco saw 2,423 new cases. Ethiopia saw 486 new cases. And the total deaths we have so far in Africa stands at 34,912. And the total deaths we have in Nigeria at the moment stands at 1,103 persons have died. I would like to look at the number of people who've been able to test, that some of these African countries have been able to test since this pandemic started. That can actually give us an idea of what exactly is going on. And of course, that's going to be the bedrock of our presentation today. South Africa, with a population of over 59 million persons, South Africa has been able to test 4,117,079 persons for COVID-19. And Morocco has tested over 2.5 million persons for COVID-19. Egypt has tested 135,000 persons. Ethiopia has tested 1,241,872 individuals. And of course, Nigeria, with our 5th position, we have tested 494,577 cases or persons for COVID-19. I must be honest with you, not just because one is a Nigerian, this number is not good enough. This number is truly not good enough. Yes, we have made significant improvement, but looking at our population, it appears to be just a drop in the ocean. Because if you look at the total numbers tested per 1 million population, South Africa, total number of people tested per 1 million population, South Africa has 69,214, almost 70,000 per 1 million population.
Which is still low.
Yes. Morocco has 67,683 per 1 million population. Egypt has 1,313 per 1 million population. Ethiopia
1,000?
Yes. Ethiopia has 10,742 per 1 million population. And of course, Nigeria has 2,386 per 1 million population.
On that, I don't know, maybe I should call it an intriguing statement, but on that we have to go on this break because that calls for a deep breath. And when we come back, most definitely, you know, as we take down our participatory show, you say go fit participate, we open the phone lines, go nowhere. Health Matta will be right back. Thank you.
We can't say for sure because for you to declare a flattening of the curve, there has to be increased number of testing with detection of fewer cases. But as it is, we've noticed progressive decline in the testing rates across various states, which is as a result of lower sample collection rates. In the month of August, we discovered that testing rates declined by up to 36%, while test positivity has also declined by about 25%. So for us to really show and be sure that what we are having is actual flattening of the curve or actual decline in the number of cases and not a pseudo decline, we need to test at least as many people as we have tested before. And maintain that tempo of testing or even improving our testing capacity on a daily basis and then show that steady decline in the number of cases before we can truly say that we are flattening the curve. So as it is currently, COVID-19 is still very much with us in the country. The response to this outbreak is a marathon, but it is a marathon that we can win. And we can only win if collectively we all observe the prescribed public health and social measures of maintaining regular hand hygiene, Nigerians washing our hands frequently with soap under running water, wearing face masks whenever we are in public spaces.
We all know wearing a face mask is not very comfortable, but the risk of getting infected with coronavirus is much higher when you are in public without a face mask. Ensure your nose and mouth are covered properly while in public places or in a closed area with several people. Wash your hands regularly and maintain social distancing. You are not at risk of getting infected from people who have recovered from the virus. Do not stigmatize against them. Stigmatization increases the chances of community transmission of COVID-19. Remember, anyone can get infected. Together, let's fight COVID-19. This message is brought to you by the Risk Communication and Community Engagement, Public Health Department, Health and Human Services Secretariat, FCT Administration.
Hello, Papa. How are you and Mama and the whole village?
We thank God. Hope you're being careful because of this coronavirus.
Papa, I am fine. Corona is gone. Everything has returned to normal. In fact, I am coming to the village this weekend. I have missed you and Mama.
Hamid, my son, we miss you too, but don't come home yet. We will be talking on phone.
Coronavirus has not gone, no. Government only relaxed things a bit to make life easy for us all. You see, that's my project. I want to finish it. So you know what? Just send me a small alert and I will send my blessings immediately.
NCDC says 3 out of every 5 persons who have died from coronavirus in Nigeria are more than 50 years old. Take responsibility, protect yourself, and do all you can to keep your older relatives safe from coronavirus. If that travel could put your loved ones at risk, think twice. This
message is from the Ministry of Health, Ministry of Information, NCDC, and partners.
Hello. Today I'd like to talk to you about how to wear a non-medical mask, also known as fabric mask. Fabric masks can be used by the general public in areas where there are many people infected with COVID-19 in the community and physical distancing of at least 1 meter cannot be achieved. There are a wide variety of fabric masks that can be handmade or purchased in a store. They act as a barrier so that you can protect those around you. They should ideally be made of 3 layers of fabric. The outer layer should be a water-resistant fabric. The inner layer should be water-absorbent, and the mid-layer acts as a filter. First, clean your hands with alcohol-based hand rub or soap and water. Pick up your clean mask and inspect it. If it is damaged or dirty, do not wear it. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Do not touch the mask while wearing it to avoid contamination. If you accidentally do, clean your hands. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. As you remove the mask, lean forward slightly and remove the loops from behind the ears without touching the front of the mask. And don't forget, wash your hands after taking off the mask. Make sure that you have your own mask and do not share it with anyone. If your fabric mask is not soiled or wet and you need to reuse it, you can store it in a clean plastic resealable bag such as this one. However, if it is dirty, do not use it. Wash it with soap and water, preferably at high temperatures after each day of use. Remember, a mask alone cannot protect you from COVID-19. It must be combined with protective measures, including maintaining at least 1 meter distance from others and washing your hands frequently. Stay safe and help prevent the spread of COVID-19.
Yes, you're welcome back. You don't hear from April Bola, you don't hear from Dr. Ocho, where she talked extensively on maybe truly we dey flatten the curves and adjust a pseudo decline and we dey get. Any which way, yes, most definitely Dr. Bastide in the building to speak extensively on this pandemic COVID-19. Vis-a-vis, he don't dey give us testing. How far so far? This time around, he is speaking numerically. He dey talk about figures. How far with this place? How much they don't test? So on top of that, Dr. Bat, you said much. So far in Nigeria now 2,000. Now we still test so far. Well, the phone lines are open.
That's total test per 1 million. That's number of people we have tested in every 1 million that we have in the population. Wow. At the moment, it stands at 2,386. So in every 1 million persons in Nigeria, we have tested less than 2,400. So that will help you to understand the number of tests we've been able to do with respect to our population.
If truly the curve they flatten, or if now assumption, because as it is with what you've said, is I think it's just a mere assumption.
The curve,
not until we test.
Yeah, let me start by paying homage to NCDC for that video clip that was used, and also credit to our own Dr. Chinwe Ocho. Thank you very much for that elaborate explanation. Now, a lot of people have been asking, is it that we have been able to flatten the curve? What is going on? In some days, we have been able to see less than 100 cases in Nigeria. Now, but if you take a closer look at those figures that we have been getting, you discover that those days that we saw reduced number of new cases, you can actually count the number of states that were tested on those specific days. In some days, we tested, I think, about four to five states. Only 4 to 5 states reported new cases. What that means is that we have stopped testing. I think earlier in the week, I was listening to PTF on COVID-19 when our SGF, Mr. Boss Mustafa, was talking about the fact that the sub-nationals are not doing as much work as was expected of them, talking about the states now. Okay, so you can see that figure today. The fact that we had a drop in testing up to 36% speaks volume about what we've been able to do. So the declining number of cases we are seeing are not truly related to the falling number of COVID-19 cases in Nigeria, but due to lack of adequate testing that we are beginning to see in the country. And of course, we need to improve. I was expecting that by now that Nigeria would have at least gotten to over 1 million, would have been able to test over 1 million individuals. So it's important we point out all of this so that...
But Dr. Bad, before we move forward, speaking of testing, what would you adduce as a factor for this very infinitesimal figure we are having? Shey na the test apparatus na no dey or na the people they fear, na the people no gree come out, because it either has to be both sides or any of the two.
Unfortunately, that is not the picture we have in the country at the moment. I will tell you that in Lagos alone, we have close to 11 private labs. And I can tell you that they are hardly enough. These are places that people will go, at least federal government has been able to peg the amount that anybody needs to pay to this private lab to get the test done. They pegged it at 50,800 or thereabouts.
That's the ceiling price.
Yeah, but in reality, those diagnosis centers are actually not doing it at that exact price. You still need to pay some fraction above that figure.
Wow.
Okay,
but above that 50 something.
No. I think a number of people that have made that tested, some paid 60, some paid 80 something, and
wow.
Of course, some said they paid as much as 100,000 to get tested. Now, you discover that what is going on in some of these states, in some of our states at the moment, is that they are no longer taking samples from individuals. They are no longer collecting samples. And of course, when you don't collect samples from people who are sick, what are you going to test? So, what the samples you collected, the number of cases that you're able that any state can dictate over a period of time will be directly proportional to the number of samples they were able to collect over that period of time. So that is just a simple mathematics. A number of states are actually doing well in terms of testing. Lagos State is doing fantastically well, but they also have the number of people that were tested in the last couple of weeks have also dropped in some cases. Plateau State, for instance, is equally doing very well. Okay, I think in the last 24 hours, both Lagos and Plateau State had 51 new cases each. That's over the night. So the truth of the matter is that the import of not testing enough is sending out a wrong signal to the population. People are beginning to believe that COVID-19 is no longer in Nigeria. And as a result, they have dropped their guards. They no longer wear their face masks. They no longer wash their hands. As a matter of fact, you get to some places, to some public places like supermarkets, you won't even have the hand washing
apparatus we used to have.
Yes, point anymore. They've taken it off. Okay, before now we used to see either a security man standing by the side, ensuring that you can't make an entrance into such a place if you're not putting on your face mask. Either you're washing your hand or you're using sanitizer. All of that are gone now. Because of this wrong impression we are beginning to get that COVID is no longer with us. And a lot of people will say, okay, why are people not dying? The reason, you may think that people are not dying to COVID. All those other brief illnesses that we'll be hearing about, sometimes over the media, died of brief illness. How can anybody tell what must have killed such an individual when we are not testing enough? So it is difficult to say what killed those people.
Dr. Bart, the airports are open and people are actually returning en masse. What can you say about this? Do you see this as a danger to the health of the nation, or you feel adequate and proper screening being done before they get into the country?
Yes, my fear is that as much as government officials are doing what they are supposed to do, the populace, the followers, we need to also do our own part, and that we are not seeing. Okay, for instance, government has put a lot of things in, a lot of interventions in places. Okay, so that if you're coming into the country, you're expected to get tested with PCR, not just antibody testing, for some days before you can board your flight. And of course, when you get to Nigeria, there are protocols that you equally need to follow. Your passport will be submitted until they ensure that you have followed all those protocols to the letters. But what is going on within the country is truly not what anybody can be proud of. Okay? As a matter of fact, when you see some people putting on face masks in some gatherings, they look odd. People look at them, what is this person trying to, what
like
message
an
is
alien.
it?
Like
what,
an alien.
what message is he trying to preach? That COVID is no longer here. Why are you wasting your money on face masks? It is not true. It is not true. Okay, but what is true is that we are not having the degree of fatalities, the deaths that we are seeing in some other countries of the world. For one reason or the other, we are not seeing that number of deaths in Nigeria. Okay? We have tried to adduce a number of reasons that could be related to the
fact
that
fatality is not high compared to some other places, but not that there is no fatality.
No.
Okay, the phone lines are open. Please feel free, chook mouth, call in. Let us hear your own view, your own take, your side of this story. What do you think? So far, so good on COVID-19, and how well are you protecting yourself? These are the questions. And please, immediately you call, help us turn down the volume on your TV set so that we go fit hear ourselves where. Make you also forget to say we waiting, say we Skype and yourself, they available. Where the ID? Now WAP TV. That's very simple ID. WAP TV. And once we dial and we go to see ourselves. Woro see woro. And I like to call them. You go see us. We go see you. Dr. Bad go see you. You say go see Dr. Bad. So back to you, sir.
Yeah, thank you. I also want to point out, I'm beginning to see a number of people that wear a tag. I don't know how many of you may have seen them. They wear a tag. They pin it to their shirt or
like
probably
an ID
hang
card?
it. Yes, like an ID card, or probably hang it on their neck. Okay, so it's called Air Doctor. Some say made in Japan. Okay, then the notion is that when you put on such Air Doctor or tag it on your clothes, it releases a form of disinfectant that sanitizes the environment.
Purifies the air.
That purifies the air around you.
Okay.
Okay, so that you won't catch COVID. And as a result of this, people who are beginning to use it are no longer using their face mask. They're no longer using, maintaining social distancing. They're no longer washing their hands.
Have you seen one before, sir?
I've seen one. So because they believe they have Ogbodowole tagged on their clothes. Tagged on their clothes.
Dr. Bad,
yes,
are you learning your Yoruba?
Yes, tagged on their clothes. And as a result, they can be infected. Okay, ACDC has actually come out to say that notion is not true. Okay, they've come out to say that theory is actually false. Now, the Air Doctor itself contains 2 compounds, chlorine dioxide and as well as sodium chloride. That is the agent. Now, these agents are not known to stay in the air for too long. So they can actually not give the degree of protection anybody claims that it could give. So you need to still, even if you're hanging anything to your clothes, we have Bolanle from Abuja.
Good morning, Bolanle. Fine, baby. How you doing? How you doing? You have to be a bit audible. We can't hear you.
Yes, I have a question to ask you. I'm very sorry. It's not regarding to
we can't hear you, Bolanle.
Hello, can you hear me now?
Yes, we can.
Better.
Yes, I said the question I wanted to ask is not regarding to the coronavirus. I want to ask regarding to one of the... Hello? Are you hearing me?
Yes, we can hear you now, ma.
Yes, I said what I wanted to ask is not regarding to the coronavirus pandemic. I am a mother of negative results. I want to ask the doctor. I had issues, and I want to clearer understanding. Can I go on?
Go on.
Okay. The first issue that I had I was given a wrong medical test. They did wrong testing for me. They told me I'm seropositive, whereas I'm seronegative. So after my first child was when they detected I'm negative. So my second child, when I was carrying my second pregnancy, I was giving Rogan injection. I think at 7 months, and I was giving after delivery, which is good for my second baby. So now I'm carrying the third baby. So I was I was not clarified. Somebody was saying that I'm supposed to take two, or I'm supposed to take one. So I keep on asking. One doctor will tell me one, another doctor will tell me two. So I don't know, maybe the Rogan injection is the time that is really working. Because I'm carrying the third pregnancy now, so I'm not taking the Rogan. Though I have the Rogan at hand now, but I was convinced that the only one I'm to take after delivery. So I don't really know. I'm really confused. How would I take it in? So is there any lapse, any time that this organ injection usually works? Hopefully, my first time I was not giving organ injection because of the wrong testing I was giving. Second time I was giving two. So third time, this I will be giving two again. So some people said two, some doctors said one. In fact, some doctors don't even really know. And it's a medical center that I'm even doing my antenatal. You can imagine that maybe there is low level of exposure of this blood group, which that we're having negative blood group. Honestly, I'm confused for over how many weeks now. At least I'm just targeting this program. Once it comes up, I'll be able to have a clearer clarification about this result of negative mothers that are pregnant. I need a clearer clarification on it.
Okay, thank you.
My man will be addressed.
Okay, thank you very much, Bola. The doctor will definitely react on it, but for further and lucid explanation, or you still have more questions, the doctor's detail will be displayed on the screen now. You can copy it and have a one-on-one with him, but I am sure the doctor must have one or two things to say.
Yes, thank you very much. The much I got from the question, it has to do with anti-D injection. She actually called the specific brand name, okay, which of course I can't mention. Okay, so it's called anti-D injection.
Can one even see? What does it do?
Nah, yes, thank you very much, sir. The anti-D injections are usually given to resource negative mothers. It must be given within 72 hours of childbirth. Now, the essence of doing that is to ensure that any mother who does not receive such an injection and gives birth, and she's resource D, depending on that of the husband, the husband blood group and all of that. The essence is to prevent having perpetual miscarriages in subsequent pregnancies as a result of things that can happen if you don't take that injection. But the teaching in Nigeria, I do know that in some other parts of the world, they usually give the injections even while someone is advanced in pregnancy. But what we do here in Nigeria is we actually give the injection after delivery. It must be given, yes, it must be given within 72 hours of delivery. And the injection is given to the woman to avoid having the blood, the sensitization of a mixture of the blood of the baby with that of the woman that can develop antibodies that can attack subsequent pregnancies. Okay, so that is the essence, to prevent such a woman from having perpetual abortions subsequently after that delivery. Let me also add that it is not only to people who delivered a live baby that can have such injection. If you're resource negative and you end up having a miscarriage along the line, if the pregnancy has gone past, I think, 10 weeks or thereabout, you should also have such an injection. If you still need more clarification, do please call me at the end of the program so that we can talk more.
Is it one? Is it two? I think that's
one is enough.
Okay.
The one that you have shortly after delivery is enough for you. Thank you very much, ma.
Thank you. Back to our...
Yes. So we're talking about the air doctor tag that some people are using and think it can protect them. Now, NCDC has come out to give...
debunk the assertion.
They've debunked the claim. They didn't just stop there. They've also come out to give a public health advisory concerning the
air doctor.
Okay, so according to them, no evidence on benefit of a doctor tax against COVID-19.
Okay, that is the air doctor on the screen, as you can see.
That is the air doctor that you can see. Okay?
Like an ID card that can be clipped to the pocket or to the clothes.
Okay, so people are using it wrongly, believing this can prevent them from COVID-19. If you're part of the people that are doing so, please ensure that you maintain the infection prevention protocols as directed by public health institutions, NCDC, Federal Ministry of Health, both state and federal, as well as WHO and others, of course, which are essentially to wear your face mask, as I am doing at the moment, especially when you're in public places, okay? It's important, as well as maintain social distancing, physical distancing, as some other people may want us to call it, and avoid as much as possible crowded places, okay? Wash your hands regularly under running water for at least 20 seconds. In situations where that may not be possible, do please use your hand sanitizer. It is essential that we know all of this. Now that our children have gone back to school, a good number of them will be going back to school this weekend. The airports are now open. Every place has been opened up. It is more than ever that we should take these non-pharmaceutical interventions very seriously at this stage. If we can safeguard whatever gain we may have made in our fight against COVID-19 in Nigeria, if we don't, we may have ourselves to blame.
This is the time to sustain it.
Yeah, this is time to sustain it. Also, on that note, I also want to talk about the fact that recently the NCDC and National Institute of Medical Research, NIMR, actually launched a COVID-19 household seroprevalence surveys. Okay, now this is going to be taking place in some selected states, in 4 selected states. Okay, it's a form of a pilot scheme, if you like. Seroprevalence surveys. What they are going to do, let me mention the states that are involved. Of course, Lagos State is there, Gombe, Nasarawa, and of course, Enugu State are the states where they will be starting this pilot scheme. They will be moving from house to house randomly to go and screen people, individuals. Okay, it's going to be a form of antibody testing mechanism to actually find out the number of people that have been exposed to this COVID-19 in our communities. They will also be testing for malaria alongside COVID-19, so that if they test you too and you have malaria, they will also have to make a treatment for you. Okay, that is what they said. Also, it will enable them to actually understand the transmission, the trajectory we currently have in Nigeria. And also it will help them to get information that will help them to relate the affectation of malaria with respect to COVID-19 pandemic in our community. Okay. So they will be moving from house to house. Just in case they step into your house, don't think they are 419ers that they've come to steal or come to do some other things. Their moves, what they are doing is official. And of course, it is going to benefit all of us at the end of the day.
Okay, Dr. Bad, let us give you the avenue to take a short break while we go on this break too. And when we come back, most definitely, Health Matta, we'll be right back. Go nowhere.
Hello? Tunde, it's been ages.
Maka, I'm so tired of this coronavirus pandemic. I am inviting you to my birthday bash next Saturday. All our friends are going to be there.
Wow, that is awesome. But I'm sorry. You know my condition now. I am managing and I can't risk corona.
Amaka, you won't even too much. Corona cannot affect young people like us.
That's not true. Coronavirus affects young and old people, especially those of us with underlying health conditions. We must be very cautious. I know families who have lost their young ones too.
So this coronavirus is real. I am calling off the party.
Even young people are at risk. Be like Amaka. Do not take risks. Wear your masks correctly if you go out. Wash your hands regularly. Maintain physical distancing. It is better to do over syllables than to regret.
This message is from the Ministry of Health, Ministry of Information, NCDC, and partners.
Babarisi, you been dey sleep when government motor show for inside area this afternoon, no? Now so them take enter Sisi Clara house, where dey the other side. They can't come out with some kind medical equipment. But it be like say she don't catch the coronavirus where people they yarn about. Oh, we self we no safe for inside area again, no. Kai, I no go even pass that house again.
Mama Risi, haba. Sure you no know say e dey good make government to check everybody where they suspect say they don't contact with people who don't carry the virus. You know mean say they get them now. Even if you say the person get them, it means say they go just carry them, make he collect treatment. If person get the coronavirus, you know mean say the person don't die. Person fit still recover. Or when they don't suspect say somebody get them, then go do test. Then fit even treat the person fast. Plenty people will catch the virus. After they collect treatment, they recover. When these government people come, make we allow them, make them test you.
This message now from the Federal and State Ministries of Health, Ministry of Information, NCDC, and them partners them.
Everyone has to wear a face mask to reduce the spread of COVID-19. Wearing face masks appropriately can help prevent the spread of COVID-19. So the more you wear your face masks, the better. Whether you are on your way to work, the market, or the bus station, always wear a face mask. When an infected person coughs, they spread tiny droplets filled with the virus into the air. Wearing the mask helps to reduce the amount of virus being spread by an infected person. When wearing a face mask, make sure it covers your nose and mouth. You do not wear it on your neck or under your chin. Avoid touching your mask often. Dispose of it hygienically. Face shields will not protect you from COVID-19. Avoid wearing them. If you must, always wear it with a face mask. Take responsibility. This message is brought to you by the Presidential Task Force on COVID-19.
Medical masks should be worn by health workers and those caring for someone with COVID-19 symptoms, persons aged 60 and over, and anyone with pre-existing medical conditions, as they are at greater risk of developing serious illness, and people who have symptoms suggestive of COVID-19. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. Inspect the mask for tears or holes. Do not use a mask that has previously been worn or is damaged. Verify which side is the top. This is usually where the metal strip is. Identify the inside of the mask, which is usually the white side. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Pinch the metal strip so that it molds to the shape of your nose. Remember, do not touch the front of the mask while using it to avoid contamination. If you accidentally touch it, clean your hands. Now, how do you take off a medical mask? Before touching the mask, once again, ensure that you clean your hands with alcohol-based hand rub or soap and water. Remove the straps from behind the head or ears without touching the front of the mask. As you remove the mask, lean forward and pull the mask away from your face. Medical masks are for single use only. Discard the mask immediately, preferably into a closed bin. Clean your hands after touching the mask. Always be aware of the condition of the mask. Replace it if it gets soiled or damp. A mask alone cannot protect you from COVID-19. It must be combined with other measures, including maintaining at least 1 meter distance from each other, washing your hands frequently, and avoid touching your eyes, mouth, and nose while wearing a mask. Stay safe and help prevent the spread of COVID-19.
Okay, thank you so very much. We thank Dr. Bat for that relevant material. When you bring to sensitize us, and we thank Ebola. So used to her now. The last few minutes of the program, yes, will be dedicated to question and answers like we've been doing. Feel free call in, reduce your TV volume, and ask anything where they do your mind, as far as not only COVID-19 they concern, or even your own well-being. So, Dr. Bat, the only question I have here, which I want you to choke out now, is so far, how far have we gone in terms of in the international communities? Yes, there is a problem, and for every problem, there must be a solution. The Russia own, we know that, okay, it's not very potent. We can't rely on that. Courtesy what you told us and what we've been hearing over the news. So how far are they going in terms of solution? We know that we're expecting something in December, if I'm right. December, January, we're expecting something in terms of a cure. Can I use the word cure? Can I use the word cure, sir?
No.
Vaccine.
Vaccine does not cure. It does not treat. It prevents.
So we're expecting a vaccine come December, January. So how far, sir, are we faring internationally?
Yeah, thank you very much. Basically, you're talking about vaccine updates. Let me start by saying that the impression you painted about that of Russia is actually, it wasn't actually what I said about the Russian vaccine. What I said was that the processes was rushed, or the processes were rushed in that of Russian vaccine. Okay. Talking about Sputnik. Okay. Now, ideally, there are stages: preclinical trials, clinical trials. When you get to clinical trials, you have a phase 1, phase 2, and of course phase 3, which is the efficacy trial, which is a large-scale trial. Okay, so the Russian vaccine hadn't gotten to phase 3 trials when they gave authorization.
Meaning we can't rely on it.
Yes, so the international community, other scientists are worried and saying that the processes were rushed, okay? And as a result, it portends some danger, okay? So that is actually the picture there. But that said, at the moment, we have researchers are testing 42 vaccines in clinical trials.
42?
Yes. Clinical trials means the vaccines that are being tested on human beings. And at least 93 preclinical vaccines are under active development. Of course, the test will be done in animals. Okay, now among those ones that are undergoing clinical trials in human, 27 vaccine candidates. My source is New York Times Vaccine Tracker, okay, as of September 25th, 2020. Okay, so the vaccine candidates that are in phase 1 at the moment are 27. Phase 2 has 14 vaccine candidates, while 11, in the last couple of weeks, it has been 999. So at the moment, we have 11 vaccine candidates at the final phase of
efficacy
trials. Yes, the large-scale one, the efficacy trial. And about five have gotten limited authorization or limited approval. None has been approved. Okay, so what do you
mean by limited approval, sir?
Limited approval is just like saying an emergency approval. If you recall, when we were dealing with the controversy surrounding the use of hydroxychloroquine and all whatnot, at a time when the American president hyped HCQ so much, he actually hurried the FDA to expedite action. So what happened at that time was that they heeded to his advice, and of course, they gave an emergency approval for the use of hydroxychloroquine. But along the line, as the trials were going on, they discovered they weren't getting the result they've envisaged. So the approval was withdrawn. Okay. Now, it is actually the country, the regulators in each of these countries that give this particular approval. Okay. It's not WHO. Okay. It's not the world. So it's actually the countries that are responsible. For instance, Sputnik, the emergency approval, Russia, yes, was given by Russian government. Okay. Ditto for a number of others. Okay. So that is what we have now in terms of vaccine. So work are still ongoing. Now the question on everybody's lip: are we likely to see any vaccine candidate that may get approved, secure final approval this year? It's so difficult to answer that question at the moment.
Why, sir?
Because a good number of the trusted vaccine candidates are beginning to, at least one of them we saw that recently, the one that was being put together by Pfizer and some other people, Oxford University. Okay, so we saw in the last couple of weeks that one of the volunteers that offered, the healthy volunteer that offered to take the vaccine actually took ill, and it was such a serious illness. And of course, the vaccine trials were halted for some time, but they've resumed again. Okay, so the truth of the matter is that the road still remains very uncertain. A good number of them, even the ones that are in the final stage, may fall by the wayside. Some may make it, okay? Some may end up with no clear results at the end of the day. So it is difficult to say.
Our hope and expectation for December, January now, is it being deemed?
Yes, it's not likely. We are actually going to see an approved vaccine in the first quarter of next year.
Okay, that's the first three.
Yes, if I can use the word of our revered Dr. Fauci, Anthony Fauci. Okay, so we have to be cautiously optimistic.
We have to be cautiously
optimistic. Yes.
Not that we should not be optimistic, but
cautiously optimistic. Okay, so I also would like to talk about what concerns us as Nigerians. Now, NCDC has actually given us a code that anybody can call if you think you are exposed to COVID-19, if you think you're manifesting some signs and symptoms of COVID-19, or someone around you, okay, there's a code that NCDC has said that we should all dial with our mobile phones. The code is *258*258#. It's being shown on our screen.
*258*258#.
Okay, so as a matter of fact, I actually did it this morning, okay? So that at least I'll be able to have something to tell our viewers. I did it this morning and I discovered that there were different stages. They will give you a set of questions to pick out the symptoms that you have. They are numbered. If you pick usually numbers 1 to 6.
Maybe cough or catarrh.
Yes, cough, catarrh, fever, difficulty in breathing. When you pick those numbers, the next stage will pop up and they will ask you additional questions. Okay. And you keep picking the numbers until you get to the final stage. Now, depending on where your symptoms are headed to, somebody will now have to call you afterward. They will leave a word that somebody will reach you afterwards. That somebody will call you afterwards. But at the moment, I'm still waiting for my own return call.
I think we have to follow the word of that doctor again. You have to cautiously
okay, so
wait.
That's a good one. You have something you can dial, at least somebody will talk to you, and of course, you act on the instructions thereof. Okay?
So the sensitivity determines at times maybe the promptness of how they will quickly call back.
Yes. Now what you pick would actually give them an idea if you're acutely ill, if you're critically
ill. If this is serious, if this can cause environmental hazard.
Of course, that's a number that we can all
call. *58*258*258#.
Of course.
Yes, so try your hand on it. I want to believe it's toll-free. I want to believe.
Yes, of course. It should be a toll-free. It should be a toll-free code.
*258*258#. Courtesy NCDC. You can always try that now while you watch. And if you try and wait till they happen, Dr. Bat tells you go see the way they itemize everything. So now you go know. But if you are really not having any symptoms, I feel we should not decongest that line.
No, it shouldn't.
Because part of what we get as problem, Dr. Bad, they say these people, they no pick. Because they are attending to some people. And some people, they use them play. Some people, they carry them play.
This also do not, the code that was shown to us a while ago does not replace the state hotlines that we are expected to call when we have those symptoms that are suggestive of COVID. Of course, Lagos State has its own numbers. Every state in Nigeria has got its own hotlines that you can reach out, that you can call. That opportunity is still open, just in case you think you're having some of the symptoms that we have mentioned.
Okay, thank you very much, Dr. Bat, for the lovely delivery. You don't really take us through a lot today. I want to say a very big thank you. And to our esteemed viewers too, we believe in us. We know say for any reason or for no reason, we no go let una down. We thank una to keep watching WAP TV na the family entertainment channel. My name is never change. I still Chief Olododo. And before I draw the curtain, sir,
keep staying safe. Very important. We'll see you next week.
Bye-bye.